The English Nurse by Professor Charles Lane Olmsted. Chapter 13, The Dentist, a Gimcheon University presentation. Vocabulary: incisor, incisor. Molar, molar. Canines, canines. Rinse, rinse. Enamel, enamel. Root canal, root canal. And pictured dentures, dentures. Cavity, cavity. Crown, crown. Partial, partial. Premolars, premolars. Impression, impression. Extraction, extraction. And pictured floss, floss. Bridge, bridge. Wisdom teeth, wisdom teeth. Occlusion, occlusion. Maxilla, maxilla. Dentin, dentin. Pulp, pulp. And pictured is suction, suction. Prefixes, suffixes, and abbreviations. Dent, or odont, or tooth, or teeth. Odontomo, tumor composed of tooth structures. Endo, within. Endodont, inside a tooth. Gingiv, pertaining to the gums. Gingivitis, inflammation of the gums. Lingo, pertaining to the tongue. Lingual surface, surface closest to the tongue. MUC, mucus. Mucositis, inflammation of the mucous membrane. Perio, supporting structures of teeth. Periodontal, involving supporting structures of teeth. SIAL, saliva. Salivary, excessive flow of saliva. Supra, S-U-P-R-A, above. Supragingival, above the margin of the gums. And S-T-O-M-I-A, suffix for mouth. Okay. Xerostomia, dry mouth. Sentences. It's important the hygienist suctions the mouth so the dentist can see and so the patient doesn't choke. This cavity has turned into an abscess, so I need to see the dentist. The bad tooth has gone beyond abscess to root canal and maybe even a crown. I never knew Grandpa had dentures until his upper teeth fell out one day. I chipped an incisor playing baseball, but I like how it looks. Coffee and wine stain the teeth's enamel. A clean tip can get back between the wisdom teeth. After the tooth extraction, the dentist will make an impression for the bridge. Sometimes when I rinse my mouth after I floss, it's bloody. The gold crown on my premolar looks shiny when I smile. I almost lost my partial when my face smacked into the windshield. Mother wears a mouth guard at night because she grinds her teeth and has worn down her molars. The maxilla does not move, but the mandible does. One tooth is very sensitive because the cavity is down to the pulp. The dentin in teeth will last for centuries. The dentist checks the occlusion after he fills a cavity to ensure the teeth line up correctly. The first day of the root canal is more difficult because of the drilling, putting in post, and impression. Some people actually sharpen their canine teeth to look like a vampire. He has to get an extraction because that tooth has lost the pulp and dentin. Sentence patterns. I have a cavity on a canine that I'm getting filled today. I have a cavity on an incisor that I'm getting filled today. I have a cavity on a premolar that I'm getting filled today. I had to get a crown on a molar. I had to get a crown on a premolar. I had to get a crown on an incisor. Doing the impression for the partial left a strange taste in my mouth. Doing the impression for the bridge left a strange taste in my mouth. Doing the impression for the crown left a strange taste in my mouth. I need to floss and brush better so I don't have an extraction. I need to floss and brush better so I don't have a root canal. I need to floss and brush better so I don't have dentures. Conversation A between Enzo and Hannah. Hello, I am Enzo, the dental hygienist, and I will check and clean your teeth. I brush twice a day and floss most days. That's good. There are new ways for cleaning. Better than flossing or easier? New ways to clean to get hard to reach places. Some of it is easier. I will show you. Does it cut down on cavities? Yes. It's called a clean tip, and it gets the hard to reach places in the back. That's good. I hate when I get a cavity back there. Do you have any teeth that are painful or sensitive? Sometimes, bottom left, middle, but not a molar. I will brush extra and it goes away. That is good. I will check after I clean so I can show the doctor. Questions. Does the patient floss every day? 2. What does the hygienist plan to show the patient? 3. Does the patient have any sensitive teeth? If so, where? Reading. Different dental fields. The dental field has excellent jobs, even if you do not want to become a dentist. They are a little on the competitive side, but worth it with the salary and working conditions. Dental hygienist and dental technologist both require degrees after high school. Dental hygienists work directly with patients and the dentist staff, so protective gear of gloves and mask is necessary. Stress can be high at times, especially time pressure. You may be having to deal with more than one patient at a time, and you are on your feet most of the day. Compassion and empathy are needed since you will be dealing with patients who probably don't like going to the dentist in the first place. About 2/3 of the hygienists are employed full-time. Part-time is possible for those needing a flexible schedule. The median salary for a hygienist in the U.S. in 2020 was $77,000. The median salary for a dental technologist in the U.S. in 2016 was $37,600. There are about 38,000 people employed in the field, but it is growing in numbers. Most are employed full-time and in small laboratories. You will not have direct patient contact, and usually the only contact with the dentist office is the written order that is placed, so a strong reading skill is needed, along with attention to detail. There are 6 areas of dental technology. The most common is crown and bridges, since all dentists deal in that area. The others are complete dentures, partial dentures, ceramics, orthodontics, and implants. The need for complete dentures varies, as does the age of the patient. It needs to be comfortable, functional, and look good. Questions. Which job has more interaction with patients? How? What are some traits needed for dental hygienists in dealing with patients? 3. What are the 6 areas of dental technology? And 4. What is the most common? Why? Conversation B, between Enso and the dentist. This is the x-ray on Mr. Kim. I also finished the cleaning and exam on him. Anything to look for? Yes, he is sensitive on several maxilla teeth. I highlighted 2 possible cavities on the x-ray. Yes, I see. The incisor is definite. We will do that now. I will get him ready. Was the incisor one of the ones he said is sensitive? Yes, doctor. After the cleaning, he said all of it felt good. Was it food or plaque? Food between the teeth. It was impacted in one area. Questions. Where are the sensitive teeth located on the patient? What is a definite cavity? 3. How many possible cavities did the hygienist tell the dentist? And 4. What was the cause of one problem? Conversation C, between the dentist and Yunjin. I need to put a crown on this cracked tooth, Yunjin. Is it going to hurt? A little. I'll do it in 2 parts. I have to shave off the surface and make an impression. How long does that take? About an hour. I put a temporary crown on so you can eat. You come back in a week and I put the crown on you. It will be like a brand new tooth. What if I don't do the crown? Then it keeps getting worse and turns into a root canal or an extraction. This sounds easier. Question. Why is the crown the best plan?